sure I'm recording. I did not do that right away yesterday, so we are recording now. But today is day 4 of the virtual wellness retreat, and I'm so excited. Today we're going to be having Jessie with Truelove, talking about functional fitness for mothers. She is so knowledgeable on fitness and what that looks like as a mom. And I just love her passion for seeing mothers be truly well from the inside out, and that totally aligns with how to thrive postpartum. Since she's jumped on, she's taught us a lot just about how to do this whole virtual thing. And she is an awesome mom. So I'm so excited to have her today. After her is going to be Mihoko Yacavone. She's talking about breastfeeding. She's an internationally board certified consultant and incorporates a lot of culture into how she practices, and it's a really beautiful pairing. So without further ado, I'm going to let Jessie take it from here, and I know you guys are going to learn a lot. So have your notes out and be ready.
Okay, hi guys, my name is Jessie Truelove, and I'm a prenatal and postpartum exercise specialist, a corrective exercise specialist. So I focus mostly on helping moms get that balance back within their body from their core canister and their pelvic floor after carrying a baby, because babies during pregnancy throw off our balance and our pressure system and the way our muscles compensate. And during the 9 months, we adapt to the changes that are happening, and then overnight, our balance changes, our pressure inside our body changes, and our muscles are having to adapt overnight to a huge change by delivering that baby, whether C-section or vaginal. So I'm going to start off by giving a little bit of my backstory and my birth story, because it basically changed the whole trajectory of my fitness business and career and where my life was going. So in 2018, I had been a personal trainer and in the fitness industry for four years. So I've been personal training since 2014. I've been an athlete all my life, a competitive gymnast for 15 years, tennis, track, all the things. And so I'd always been really, really active. And then beginning in 2018, I was also bartending at the time, and that was the year I decided I was going to really go full force into my fitness business. And then I found out, this was at the beginning of the year, I kind of set the tone for the year. I was gonna get my website going, get my ebooks going, and get a 6-pack, super important. And then I realized I was pregnant about 3 days after all these proclamations that I made. I was like, well, I'm gonna be very pregnant by fall. So I kind of saw all of my fitness goals and dreams go down the toilet. And I was very active through my pregnancy. I pretty much didn't change anything. I pretty much listened to my body. And so if something didn't feel right, or if I got too winded, I would slow down. But I really didn't have any knowledge or education about pelvic floor function, about core breathing. I didn't even know what a diaphragm was, which is so scary, because I was a trained personal trainer to help people, and a lot of people are postpartum. Once you have a baby, you're postpartum forever, and then when you go in to seek help, professional help from a personal trainer in a gym, you expect them to know what they're doing, and a lot of them don't. That was me, Exhibit A. I knew how to get strong. I didn't know correct breathing mechanics, which is so, so powerful. You are not supposed to hold your breath and bear down on your pelvic floor when you lift things up. So when you see really, really strong people with the weight belts, that's because they're not actually that strong. We're creating a fake abdominal strength there by having that brace, and that pressure has to go somewhere, and usually it goes down. So after a certain amount of time, breathing the wrong way, lifting with the wrong mechanics, you're gonna create an injury. So I had a very active, very easy pregnancy, and my delivery went everything the opposite of what I wanted. I was in labor for 26 hours before having an emergency C-section. I had my water broken, I had my membrane scraped, I got an infection in my uterus, my placenta was failing, my baby's heart rate was dropping with each contraction, I got an epidural. It was literally the opposite of what I wanted. I was allergic to my catheter after my C-section. Okay, go. And so it was really, really discouraging to know, after all of my hard work, after all of the training, after everything I thought I had done right, that I was gonna have a C-section. And I felt like my body was failing. I felt like I maybe had created the problem. I felt like maybe I wasn't capable. And that's kind of what the doctors instilled in that moment also. Told me I was never gonna be able to have a vaginal birth, which was very, very disheartening. And my body kind of just felt numb, mostly because of the epidural. But mentally, I was super, super numb. I felt like, you know, after everything that I had done, my body just completely failed me. And it wasn't until months later that I realized C-section or vaginal or the way you planned or not the way you planned, birthing a baby is a success. Your body doesn't fail you. Your body is trying to work with you. And it was because of my lack of knowledge, because of my lack of support in the hospital, because of the lack of education that women are just not given when they're pregnant. We don't take, it's not mandatory to learn how to push a baby out. They just expect you to know. And then when you don't know or you're not ready for it, they tell you that you can't and that now we're going to intervene. And most of the time, they don't even give you enough time to actually go through that process. No, thank you. And so I had the C-section. I was crushed. And I went through a little bit of postpartum. It wasn't very severe. My husband really, really helped kind of bring me out of it. But, oh my gosh, I had never felt more like a stranger in my own body. And you know, coming from the fitness industry, I had such a strong connection to my physical body, the way it looked, that when I didn't have that anymore, oh my gosh, my mental health went down. And where does that stem from? I think that stems from the presence of social media. That's one topic that I'm going to talk about today. The social pressures that women have on them, unlike pressures that any other group of people have on them. We bring life into the world. We keep pouring from our cup, even when it's empty. And who is to pour into us? Because it wasn't the medical system. I didn't feel that. It was a very hard time for me. And going through my own postpartum period, going through a time where I felt like a stranger in my body, where I couldn't figure out why I was having pelvic floor issues because I had a C-section. I never pushed a baby out of my pelvic floor, so why was I leaking? Why was sex very, very uncomfortable? Why I felt like I couldn't put my arm over my head because my C-section scar, I felt like I was hunched over. My posture was terrible because I felt like I was breastfeeding for what felt like 24/7. And then you get one post-op appointment, and then it's all about the baby forever now. You are checked out. You are cleared for your regular activity, whatever that is. We don't know what regular activity is for each individual person. So what did I do? I wanted to hop back into what I was originally doing before I got pregnant, because that's what the doctor tells you. You can go back to whatever you're doing before, and if it was a vaginal delivery, 6 weeks, and if it was, no thank you, and if it was a C-section, it's 8 weeks. At 8 weeks postpartum, I felt awful. I didn't feel like I could even, my belly felt empty. I didn't feel like I could connect to my core at all. And being a trainer, I was like, what the heck? Like, I need so much help right now. And it made so much sense to me because Move with Truelove started off as a cardio weight endurance class for women, group fitness setting. And I would have women come in and I would kick their butt. Like this was before I had my baby. We would have such good workouts. They would leave sweating and they would never come back. And I couldn't figure out why. I was like, why are these women coming? They're getting a great workout and then they don't come back. And it wasn't until I started going back to my fitness routine, until I started taking a couple classes to kind of like clear my head. I didn't have to think about what my workout routine was going to be. I would just go to a workout class and I was leaking. I was literally peeing my pants while doing jumping jacks. And I'm like, gosh, and everything that they're doing, I'd had to modify. And I realized the women that come to my class, 20s, late 20s, 30s, 40s, once you are postpartum, once you have a baby, you're postpartum forever. So these women that were coming to my classes fearful of peeing their pants. Women were coming to my classes having to modify every single exercise. Nobody wants to go to a class and feel like they aren't up to the standard of the class and have to modify every single thing. They want a class that's just for them, that challenges them, but they don't feel defeated when they leave. And my whole mentality around fitness changed after I had my baby. It changed from an aesthetic, from being very, very strong. I was deadlifting a ton of weight before I had my baby, lifting 255 pounds, and I'm 5 foot. What the heck was I doing that for? To prove a point, you know? And then I ended up throwing my back out, lifting a bag of dog food because I didn't have the correct breathing mechanics and lifting mechanics. And so the point I'm trying to get at here is after I realized that myself, I was peeing my pants, a trainer, personal trainer, and I was bringing these things up to people, and they're like, oh yeah, well, that's motherhood. Like, that's the price you pay. Like, you have a baby, you're going to pee your pants forever. Like, if you sneeze, you're going to pee. Like, that's just how it goes. If you talk to the older generation, first of all, they don't want to talk about it. Second of all, it's just what happens. This is what you have to live with. This is the narrative that you are told when you have a baby. You're going to be leaking. Sex is never the same. You're going to have that C-section pooch forever because there's nothing you can do about it because scar tissue is forever. It's just not true. None of that is true. The point is that when we educate moms, when we give them the tools, when we give them correct breathing patterns, when we give them power within their laboring and their birthing process and the recovery, we don't place arbitrary timelines on them like 9 months in, 9 months out. It doesn't make sense. It's not for everybody. Tissues in the body take anywhere from 18 months to heal. And if you're breastfeeding, it's going to take longer because we've got those hormones working against us, keeping everything nice and relaxed because we are feeding our babies, and that's what the hormones do. So, and your body is very, very smart. When you are breastfeeding, it doesn't want you to get pregnant. So what happens then? Sex is very uncomfortable. And it's not you, because I felt terrible for myself, and I felt so bad for my husband because I didn't give birth vaginally, and nobody told me that, hey, the hormones that you're experiencing right now, they're going to last for as long as you're breastfeeding, which is still 21 months. And let me tell you, since cutting off the breastfeeding, we do it one time at night for 10 minutes. It's a comfort thing. I have felt so much stronger. So just knowing that as long as you're breastfeeding, that you're going to have that extra elasticity within your tissues can give moms a sense of, okay, well, this is normal. This is what's actually happening. And when I'm on social media scrolling and I see moms that are Fitspo or influencers that are fitness based, and they really don't have any knowledge, but they've got a really great butt and they've got a 6-pack, which, you know, good for them because that's amazing. And 2 things I've never had, but you know what? I don't pee my pants anymore. So, you know, everybody doesn't need to have a visible 6-pack, but every mom deserves to not pee their pants when they sneeze or cough too many times in a row, or when they step off of a curb, or when they stand up out of a squat picking up their kid. Every mom deserves to know that she is going to get stronger with the right tools, with the right education, with the right exercises and breathing. Every mom has that capability, and it is not going to happen within the first 6 to 8 weeks. You are not back to normal. And telling moms that you can go do whatever you're doing at 8 weeks is so dangerous. Not only physically, but mentally. When they can't go back to their regular activities 6 to 8 weeks later, they're like, okay, well, something's wrong with me, obviously. Like, they told me I was clear. They told me I could go back to do all these things. And when you cannot, that is so much on your mental health, even more than physical, because now you're believing that something is wrong with you, but don't worry, you don't have any more time to go talk to your doctor because you got your one appointment, and now it's all about the baby, and so does everybody else think it's about the baby too. Everybody that comes over to visit, they only want to talk about the baby. That's a whole nother topic. But what I want to talk about is the timelines and social media pressures. So if somebody had a ACL that was torn, and you know, they can't go back to their sports anymore for a while, they need to heal and recover. So we wouldn't expect them to, whatever timeline we've given them, hey, you can start rehabbing at 8 weeks. We would not expect them to be back at 100% at 8 weeks. So why are we putting that pressure on moms? It is an injury. It is an atrophy of muscle. So the decrease in muscle tone over 6 to 8 weeks when you're told to do nothing, even though this is good news, ACOG has recently let out in their 2020 pregnancy and postpartum fitness guidelines that mom is able to return to pelvic floor and gentle core exercises as soon as she feels ready. That's amazing. That is incredible, because we have been telling moms, don't do anything until 6 to 8 weeks, but what does that do to her mental state? If I'm not able to move my body, which creates those endorphins, which gets my mind and my muscles and my body connected, for me, which I know, you see your babies, they run around 24/7. You know that the body is meant to move and is meant to be active because that does something for our mental state. So mentally, that is a plus. We want to keep moving. We want to feel engaged and connected to our body, because if our mind is not connected to our body, this is the vessel we live in, mamas. And so we need to make sure that we feel powerful and strong and connected. Not only that, we cannot go 6 to 8 weeks and not start to build not only mind-muscle connection, because you cannot strengthen a muscle you cannot connect to. I'm going to say that again. If you do not have the ability to contract your lower abdominals, or to do a Kegel, or to do a pelvic lift, you cannot strengthen the muscle that you cannot connect to neurologically. So during this first 6 to 8 weeks, we are spending a lot of time. We're not doing crunches. We're not ever doing 1,000 crunches. We are connecting our mind and our muscles and reestablishing those neurological pathways to those muscles that we lose connection with. So pushing something through our pelvic floor that is much, much larger than the original space, we've got muscle tearing, we've got tissue stretching and tearing. It takes time to heal. Like I said, tissues and connective tissue takes upwards of 18 months to heal, especially if you are breastfeeding. It's just the hormones. They're kind of working against us, and so we've got to be patient, we've got to be gentle. We can't work past what we are capable of doing. We want to progressively overload the system, but not push so far past our threshold that we create compensation. So if I'm not able to keep my core and my intra-abdominal pressure regulated, my back is going to kick on. So if you are on the ground on your back and you are doing marches, we see marches as DR safe, the ab separation safe on Instagram all the time. If we are doing marches and our back is arching, now I've just put a ton of pressure into the front of my core. So we're creating those muscle compensations. So my back is taking over. I have a ton of pressure going out to the front. So what is that going to do? We're going to create muscle imbalances. So if the core is shut off, the back is going to become overactive, tight. We're going to compress the spine. We're going to get a lot of back pain. And that core is going to be sticking out, and all that pressure is going to be going out into our core. Over time, this creates injury, like herniated discs from bending over all the time because we're clenching our glutes because our pelvic floor is trying to work so hard and so tight all the time that it gets too tired, and then the glutes take over. So vaginal deliveries, we've got a lot of tearing and stretching of those muscles, the pelvic floor. So what's going to happen is we don't have the ability to hold our pelvic organs underneath us and lift it in the pelvis. So what happens? The upper abs underneath our ribs, our external obliques, the ones that we stay most connected to during pregnancy, because the bottom ones are more stretched out from the baby. These upper abs are going to become really, really tense postpartum because they're the only ones that we have connections with still. We just pushed something out of our pelvic floor. We have torn and stretched out those tissues. We're losing connection down there because they're too long. They don't know what to do with all this length, and so we can't lift it. We can't neurologically connect to those muscles right now until we give it time to heal. So if these overactive upper abs are too tight and too overactive, they're going to pull down. So we get that forward rounded posture that we already have from breastfeeding. It's going to put a lot of pressure down on our pelvic floor. Now, if we have a C-section, now you may think I thought that since I had a C-section, my pelvic floor would be fine. What they don't teach you is that the pelvic floor works synergistically with the lower abdominals and then upward into the core canister with the diaphragm, the TAs, internal obliques, external obliques. The whole entire core is connected to the pelvic floor. So when you shut down a group of muscles, like from cutting them, so if you have a C-section, you cut those muscles, you shut them down. There's no way for them to work because there's a cut. They've been shut down neurologically. Those neurons are not getting sent there anymore. There's no connection. So if the middle and the lower part of our core is shut down, somebody has to take over for our core stability so we can stand straight up. That's going to be the pelvic floor for C-section mamas. What happens if your pelvic floor is working to do its job by stabilizing the pelvic organs and stabilizing the pelvis and the hip? If this muscle has to also work the front, so work the core, your abs, this muscle is going to get very, very, very tight and lifted. Over time, this is not how the pelvic floor was meant to work and function with your breath. So your breath is not going to go all the way down. You're not going to get that lengthening and relaxing with the inhale. We're going to go over all of this tomorrow in our little workout and breathing. It's going to be super, super gentle, focusing mostly on mind muscle connection and the breath. So when you inhale down, pelvic floor should open, release, lengthen. If you don't have that ability, you may have a tight pelvic floor. If you experience pain during sex, like nothing is able to enter your pelvic floor, if you feel kind of it's closed, it's not letting anything in, you're overly tight. You could also have a hypersensitivity, like it's a reflex. Pelvic floor is very, very strong. Nothing will go in if you don't want it to. Also, be careful with that. Also, if you experience leaks and your pelvic floor is very, very tight, you can also experience leaks if you have an underactive pelvic floor, not a very high muscle tone down there. So maybe you're not able to connect down there really at all or get any kind of lift. It can kind of happen both ways. So if your pelvic floor is very, very tight and cannot lengthen, it's not able to move through its full range of motion. Over time, that muscle gets weak from being stuck in one position. Not able to move through its full range of motion would be like keeping your arm out to the side. Like when somebody says that they were told to hold a Kegel for their entire run, that would be like me asking you to go on a walk and hold your arm out here all day long for the entire walk. Kegels are not the end all be all. That's one range of motion for the pelvic floor. And so is this. This is one range of motion for my shoulder. Now, if I decided that I was going to keep my shoulder out here for the entirety of a workout or the entirety of a run, you think over time that my arm would get stronger? No. What's going to happen is my body's going to start compensating and doing weird things to make sure I can keep my arm up because I'm asking it to. If you are asking to keep your pelvic floor tight and contracted so that you don't leak because you're scared of leaking, what's going to happen is the glutes are going to take over. So if normally we're standing in an upright position, pelvic floor is so tight and I'm still experiencing leaking, what's going to happen is the glutes are going to grip. You're going to get this backward rotation of the pelvis, and we see this all the time where moms are tucked under and they've got that little wedgie in the back. Their glutes are desperately trying to gain pelvic stability for the pelvic floor because the pelvic floor is too tired. So we need to trust the pelvic floor. We need to be able to fully relax, fully contract through the full range of motion. We would never keep our shoulders up here. This is a range of motion of our shoulders, but keeping our shoulders up to our ears, we're going to create a lot of neck and back pain. We don't want to keep any muscle very, very tight for the entirety of anything. The pelvic floor is an anticipatory group of muscles. So what that means, along with the deep core system, the transverse abdominis, the corset muscle, very, very popular right now to talk about, that TA. Let me make sure I'm not going over time. I don't know what time it is. I've got a couple of minutes. So the TA, pelvic floor, they work together. It's your deep core system to stabilize the spine with the intra-abdominal pressure that we create with our inhales and exhales. Intra-abdominal pressure is the pressure we create with inside our abdominal cavity, with our abdominal wall and our organs. So what I want to say about those muscles being anticipatory is they anticipate impact or movement. So when you go to step off of a curb, you get tight here to stabilize the spine. We don't want to just be tight all the time, because if we need to contract, we don't have the ability anymore. If for some reason we need to lift the pelvic floor, like for a jump or for coughing or sneezing, it's a really good way to make sure that you're not leaking is right before you cough or sneeze 3 times in a row. You give yourself a little pelvic lift. You can also lean forward a little bit. So like I said about the glutes being tucked, if I'm tucking my pelvis under, this does not make it very easy to contract the front of the pelvic floor. So if your pelvic floor is overworked and you're gripping all the time, it's going to get tired, it's going to get weak. So the glutes are going to take over. They're going to squeeze down, they're going to flatten out, hence the terrible term mom butt or flat butt, because after we give birth out of our pelvic floor, we're weak there because we don't give ourselves enough time, and then we get stuck in this posture, and then we're not able to contract the front of the pelvic floor when we're tucked under. So it makes sense that if you have overactive pelvic floor, it's going to get weak and tired. Then the glutes are going to take over. Your glutes are going to get flat, and you're still going to leak because that posture sets you up for failure. If you ever think about how they set you up to give birth, they tuck you under and they bring your knees all the way up to your chest because it is a straight shot out of your pelvic floor. You are at greater risk for pelvic organ prolapse if you tuck your booty in your normal posture or when you're sneezing or coughing. It's a straight shot out. So we want to make sure, just to end this off, we're going to go over this deeper with a little bit more instruction tomorrow with the breathing and some different exercises that we can do. But we've got to establish the great breathing pattern. Women are told to hold in their gut from the time that they're 12 years old. I'm going to show you again. If I'm holding in my gut here, if I'm sucking in my belly, that does not let my breath go down. If I'm cinched right here, I'm sucking in on the inhale. So instead of breathing in and expanding 360 side to side down my pelvic floor, instead on the inhale I go like this and I suck my chest up and everything comes under my rib cage. Now on the exhale, which should be a forced exhale, lifting of the pelvic floor, nothing has anywhere to go except down. So a sneeze or a cough is a forced exhale. Yelling for the dog or for your kids is a forced exhale. So if I'm sucked here all the time and I go to yell or to sneeze or cough, all of the pressure that I just created in my chest that is supposed to come out on the exhale, since it's already in my chest, the only place it has to go down is down. So chest goes down, my ribs and my upper abs grip down. I got the pooch out in the front, my butt tucks, and I've got all that pressure down. So if you are doing this paradoxical breathing pattern and you are experiencing leaking, it's no wonder, because on a normal inhale, you're supposed to inhale down to your pelvic floor, lengthening and expanding front to back, side to side. On an exhale, you lift pelvic floor. Pelvic floor initiates the core contraction, initiates the lift. So you close the back opening, close the front opening, and then lift. So it's not just closing it and then lifting, or closing it and then leaving it there. You have to close and then lift up and towards your spine. It's just so much deeper than holding in your gut. That creates imbalances. We shouldn't be holding in our bellies because that's not how the abdominal canister was meant to function. We need to have expansion, just like with the pelvic floor, just like with our arm moving in all range of motion. We can't just hold our arm here or hold our shoulders up to our ears and expect it to function normally and to expect not to create an injury or compensation later. So yeah, I mean, we can go into this a little bit more tomorrow. I will cover paradoxical breathing patterns. I will cover normal breathing patterns, what we want to establish, and some great posture and a couple exercises that we can go over. My main thing I just want to get across to everybody is to not let the timelines of other people affect your own, because we all are going through postpartum and pregnancy at different rates. Pregnancy does affect everybody the same in the fact that when we have the baby in our belly, we have a lot of pressure down on our pelvic floor. Regardless of how you deliver your baby, there is pressure down on the pelvic floor. That is going to require healing. There is pressure out on our abdominals. 100% of women at the time of delivery have abdominal separation, a diastasis. It is not something you can prevent. It is something that we want because our body's making room for our baby growing, which is amazing and magical, and we want that to happen. It's been such a demonized thing, diastasis. So it's 100% not avoidable during pregnancy. It is 100% avoidable in the fact that we don't need to exacerbate something that's going to happen, so we can take precautions to make sure that we're not furthering that separation and creating an injury. And then, my thoughts. And then up on your diaphragm. So not being able to get a full breath of air. So pushing up on your diaphragm, out on your belly, and down on your pelvic floor. Every single woman experiences this during pregnancy. We are all the same. We are all in the same boat in that respect. When you see fitness people on Instagram with their little baby that's 6 weeks old after their 6-week checkup, doing burpees and doing all the things, I literally want to report it because it's so dangerous, because vulnerable women are watching. And they think that's what they need to be doing at 6 weeks. And you know that that mom is hurting. You know that she's probably peeing her pants. You know that she probably is feeling that really empty feeling in her belly and the separating of her diastasis even more. And you know she's doing it because she feels the pressure of her audience on her Instagram page. So do not think that that's what you need to be doing. You need to see somebody that is educated in postpartum fitness and is educated on women, in the woman's body and breathing mechanics and all the things. Just don't go see any regular personal trainer. My postpartum and pregnancy section of my personal certification for when, I had been NASM, which is the highest rate of personal training certification you can get. My pregnancy and postpartum section in my book was 2 pages. That's all the information and all the considerations I got for pregnant women and postpartum women, which is a huge population. Everybody is postpartum once you have a baby. So get somebody that's educated. If you can't find somebody that's educated, educate yourself. And that's my story. Thank you so much for having me, you guys. I'm so passionate about this, and women deserve to be strong after their babies. We don't need to worry about having our body back. It didn't go anywhere. We're still in the same body. Nobody wishes for their 12-year-old body back, so don't wish for anything before you had your baby. You did a magical, powerful thing, and you're gonna be powerful again. It just takes time. It takes healing. It's a journey. It's a process, and it doesn't happen overnight. You didn't create that baby overnight either. So, yeah, that's my preach for the day. Sorry, guys, I'm getting all riled up. Does anybody have any questions? I know I've gone over time. I'm so sorry. I don't know where to see the questions. I don't know if Kirsten, you want to tell me?
Yeah, I posted in the chat if anybody had questions. I don't think anyone.
Okay. Yeah.
But I think
I might have rambled and answered them all.
you did good. No, I think everybody probably can see why we were so excited to have you on board, because you like made me get like all amped up in what we were doing again, and you're just infectious. So it's so awesome to have you on this team. And we're so excited because Jessie, like I mentioned before, is going to be having a fitness mini course for us that's deep diving into everything she talked today with examples and videos. And obviously it brightens up the room too. So it's really exciting to have her on board. And tomorrow's going to be really cool because you're going to have some takeaways that you can start practicing tomorrow. So
yes. So yeah, everybody get ready to move a little bit. We're just going to move just a little bit.
Yep. Wear your fabletics. Boom.
Yes. Wear those high-waisted yoga pants.
Yes. Every day.
Yes.
All right. Thank you so much, Jessie. You're so awesome.
Thank you so much.
Next, we're going to go ahead and move into our next speaker, which is Mihoko Yacavone. She is an internationally board certified lactation consultant. She's here in Hawaii with me on the island of Oahu, and serves our local community. So she does it beautifully and is just such a gentle, beautiful spirit. So I'm excited for you to meet her. And Mihoko, I'll let you take it from here.
All right, thank you so much for that sweet introduction. I'm gonna try and see if I can share my screen. Let's see, share screen, is this how you do it? Wait, here. Hold on. Can you guys see it? Okay, awesome. So yeah, I'm just really enjoying all the sessions. I started taking pictures with my kids yesterday, and I love Jessie's energy. I'm excited to move a little bit tomorrow. So today I'm gonna be talking about breastfeeding, just a little bit about myself. I am a lactation consultant as well as a dietitian, registered dietitian. I have my master's in nutritional science. So I love the biochemistry behind how nutrients work and the mechanism of breastfeeding, but I'll try not to get into that too much because it's a little geeky, but let's see. Oh, wait, how do I get to, sorry. Just a little bit about myself. I've been a dietitian for the past 17 years and working in a women's and children's hospital for the past 12 years. And being in that setting as a dietitian, you cannot really bypass talking about breast milk and breastfeeding when it comes to infant nutrition. So when I became pregnant with my older daughter, I was encouraging moms about breastfeeding and telling them about the benefits. And I knew for sure that I wanted that for my kids too. And I was feeling pretty confident that I can breastfeed, but things changed quickly when she came at 35 weeks, considered a preemie. And then she also had jaundice and tongue-tied, and she was losing her weight pretty rapidly. And also my dad was diagnosed with end-stage cancer at that time, and my mom couldn't come to support me because she was caring for my dad. And just everything kind of came crushing down, and I was feeling disappointed of myself, discouraged. But long story short, I was able to breastfeed my daughter exclusively, meaning without formula. And when you think back, this is like 10 years ago in a hospital setting. If you have a child in that condition, most likely the answer was formula, at least for that little while to pull her out of that like rapid weight loss and stuff. But yeah, I had amazing support and a great advocate who is my daughter's pediatrician. She talked to the nurses saying that we're gonna do this just with breast milk. I'm gonna come every day to check on her. Yeah, so she was amazing. But despite that, I was feeling pretty incompetent and discouraged. So I told my husband, like, I think we should do formula. But again, he told me, like, I think you're gonna regret that decision. I know how much this means to you. So he kind of helped me rethink about that situation, and I was able to really just do with breast milk. They really pulled me out of that dark time that I had. But So through my experience with that, I felt that I want to be that person when the moms are tired, exhausted, confused, that I'll be the voice, be the cheerleader for them. And that's how I started my own practice, Ohana Breastfeeding and Nutrition, to help moms achieve the goals that they have. So that's about myself. I'm gonna dive into our talk today. Oops. So what we'll be talking about today, why breastfeeding, the benefits of it a little bit, when to decide to breastfeed, things to do, know, have before delivery, because once baby comes, it can be really chaotic, right? So, and then what to expect once baby comes, and then I'll answer some common questions that moms may have. Okay, so, wait, I'm so sorry, I'm having a hard time like going to the next. Okay, so benefits for baby, I'm sure you all kind of know this already, but number one, it's ideal nutrition for baby. It's only like vitamin D that you are told to supplement if you're only breastfeeding. Even that, if mom is getting a lot of vitamin D in her body and her diet through supplementation, studies say that there's enough vitamin D in breast milk, so you can really just do breastfeeding and not worry about supplementation, because studies show that only like 23% of the kids are really getting that supplementation. And then it contains so much more than nutrition. If you can see this little bar graph, it has hormones, enzyme, growth factors. I'll talk about it later on, more about it. Decreased disease risk. Infection rates are so much lower, like respiratory infections, ear infections, so many. Also promotes healthy weight. Research shows 15 to 30% less obesity rate for breastfed babies, promotes brain development because of the hand-eyes coordination. IQ tends to be higher for breastfed babies. Oral cavity development, this is talked about a lot. When babies breastfeed, mom's breast tissue goes into their mouth, which opens the jaw, widens the jaw of the baby. When their teeth comes out, better alignment, they can chew better, they can digest better, they can think better. Also, when babies take the bottle, it has a tendency of raising the upper palate, which raises the upper nasal cavity. So babies tend to mouth breathe more. And when the air goes through the mouth, not the nose and not filtered, higher sickness, illnesses, and also gut health. I'll talk about that a little bit later because there's so much going on with the gut and breast milk. Okay, and then benefits for mom, reduce risk of hormone-related cancers like ovarian, breast cancer. Again, decreased disease risk, less risk of depression, help uterus contraction and recovery. May help with weight loss. This is a little tricky because, you know, yes, we are spending more calories to make breast milk, but it's not a drastic weight loss that you're looking at. You know, there's a little bit more tricky. It has like hormones involved. It took 9 months to gain that weight. So we're kind of looking at like gradual weight loss. We want to replenish moms with recovery, all that. So gradual weight loss we're looking at, and then also saves money and time. Okay, let's see. So if you decide to breastfeed, things to do before baby comes. So communicate to your ohana. So ohana means family here in Hawaii. So it doesn't have to be your blood related family only. Your relatives, group of really close friends, let them know your breastfeeding goals. So when you're not able to, you're lost, confused, they can be the support for you. Finding a pediatrician, midwife, and a hospital who supports your goals. Really, really important, because if you want to do one thing, but your doctor says otherwise, it's really hard to go against that. So interview your pediatricians, midwives, ask that question. What is your take on breastfeeding? Do you have a lactation consultant working with you? Who do you refer out to? Things like that. Also, meeting with a lactation consultant will be awesome if you can do that. With the pandemic, if you are doing hospital delivery, a lot of hospitals are trying to get the babies and moms out as much early as that's possible, discharge them as fast as possible because of the pandemic. So you may not be able to meet with a lactation consultant. And also when you're tired, you may not be able to think well, but if your body remembers how to latch baby on or how to do like different positions, that'll be great. So meeting ahead of time, actually doing the hands-on motions may help a lot. Later on, I'll show you a video, and in that it talks about the importance of getting the milk out within the first 1 or 2 hours after delivery. For any reason you're going to be separated with baby, hand expression is a great tool to know you can get your milk out with your hands. And yeah, throughout your whole breastfeeding journey, it's a great tool to have. So I'm learning about that. And just, as Jessie was talking about, like knowing what to expect, knowing what's normal makes a huge difference. So yeah, learning from your consultant about that makes a big difference. And then the things to know before baby. So there's options. Say that you did a hospital delivery and your nurse comes and tells you that, we need to supplement your baby with formula. I hope that before it goes straight to formula, that the nurses will consider giving breast milk to baby and then formula. But unfortunately here in Hawaii, for some hospitals, that's not the norm yet. So when you face that situation, know that you have options. And again, if you're working with a consultant, great, you can call her, text her, if you're not sure what to do in those situations, but know that there's options. Also, you're going to be tired not getting that long stretches of sleep that you had before when you were pregnant. Your sleep is going to be interrupted. That's going to make you really tired. Also, knowing that you may come across breastfeeding challenges. So you might be feeding like 10 times a day for however long you decide, like 3 months, 6 months, 10 months. If you do feeding so often, most likely you're going to come across some hiccups. But this is where our healthcare system fails moms, that we don't really inform moms enough that there might be some challenges. So just knowing that makes a big difference. And if you do have challenges, know where to go. Is there breastfeeding clinics in your community? Who's the consultant in your community? And again, if you do need to run a hospital grade pump for any reason, know where you can go to rent those hospital grade pumps. And then things to have before baby. You really don't need to have a breastfeeding pillow to breastfeed your baby, but I know a lot of moms do. If you are going to get one, I strongly recommend this top one right here. This one is a little more firm and has a back strap. So when you move, the pillow moves with you. The bottom one, it comes in really cute covers and stuff, but as you can see, it has this like little curve in the inside, and that's where the baby kind of drops and sinks in. So a lot of moms still have to put like additional pillow or a blanket to like lift baby up. And yeah, like some moms really love that bottom pillow. So if it works for you, great. But I've seen a lot of moms struggling with that. So if you're thinking of getting a pillow, I strongly recommend getting the top one. And then breast pumps, most insurance cover your electric pumps. You just have to go through a process, so do that ahead of time. The bottom one is the silicone Haka pump. It's really not a pump in a way that it doesn't actively get your milk out. It's more of a silicone milk catcher, kind of. It kind of sticks to your breast. So if you're feeding baby on one side, if your milk is leaking, it kind of catches that leaking milk. We don't really recommend active pumping before 4 to 6 weeks after delivery, because we want baby to drive your milk supply. So this is a good alternative to catch your leaking milk. Nipple creams, if you're doing hospital delivery, most likely you're going to get this lanolin cream. Great for prevention because it's thick, but once you have any openings or whatnot, you want to go with a thinner cream so that the air goes in and out and aids in healing. So these creams are usually made from olive oil, coconut oil, and these are good to have because once you have the opening, it's kind of hard to like get one. You have to order through Amazon. It takes a few days. Snacks and meals, you're going to be using more calories to make breast milk. You're going to be more hungry. So it's really great to have something where you can eat with your one hand. So bars, nuts, fruits, musubis if you're in Hawaii. And then also meals, you're probably not going to have time to make your, gourmet dinner and stuff. So if you can make some ahead of time, keep it in your freezer, great. You can organize like a meal train among your family, friends, have them delivered to you. Also, there's some services where they deliver the meals to you. And I think Kirsten, you might have some lead here in Oahu. So if anything, ask Kirsten. And then what do you do once baby comes? I have this video. Let's see if this will work. Okay. Did it go? Oh, there. Okay. Oops. Oops, sorry.
Highly developed sense of smell searches for the scent of your milk, which is unique in each mother and familiar only to her own baby. For this is the same unique fragrance your baby has known for months while bathing is protected and nourished fluid. By instinct, breastfeeding right after delivery is the way all newborns of all mammals give protection to their young and prevent serious feeding problems, such as having too little milk. It's this first hour that's most important. Your baby has been held all of her life. Contact with you is exactly what she needs. Nothing's more important than a mother's touch. How you can use your hands to help with breastfeeding is what you'll learn here. You can remember 3 easy points. Let's call them A, B, and C. How can you help her latch onto the breast comfortably and effectively? Let's call this A, attachment. This is important. You see, the way a baby gets milk from a breast is not by using the nipple as a straw, but by using her jaw and tongue to massage underneath the nipple. The nipple is protected far back in her mouth, and milk is easily expressed. If the nipple is closer to the lips, it becomes compressed and less milk is expressed. Many babies manage this without any help, especially when given uninterrupted time on their mother's chest right after birth. Others, and this is very normal, need a little hands-on help to gently guide the breast comfortably back into her mouth.
Just like that. Squeeze a little colostrum out of there for her. Beautiful.
You can use your hands to support your baby and your breast. One hand shapes your breast to fit easily into her mouth. The other hand guides her to the breast just when she is ready with a wide open mouth, so she can easily latch on to the breast and not just the nipple. How can you make sure you produce a rich supply of milk to feed her? Let's call this B for breast milk. It is the frequent expression of drops of early milk beginning in the first hour that trigger your milk supply to increase in several days. The critical sign to your breast to make a lot of milk later on is to remove a small amount of first milk early and frequently. Hands can be better than a pump to massage out the small amounts of thick and creamy early milk. Where you place your fingers and how you press will make a difference. Hold your hand.
So I'm gonna stop here. Let's see, hold on. Oops, wait, hold on. Okay. So we saw in the video the importance of skin to skin, and this is just like once baby comes, just putting baby on your chest or your abdomen, and this can be done even after a C-section. And there's tons of benefits to that. It regulates baby's temperature better, better heartbeat regulation, and then blood sugar regulation, all of that. When you can do this skin to skin, baby doesn't have to stress out or use too much energy to achieve that, ideal temperature and stuff like that. So less weight loss. And if mom and baby get separated, definitely try to do with a partner. Same kind of benefits are seen doing skin to skin with a partner. And the frequent expression of early milk starting the first hour really triggers your supply. So if mom is separated from baby for any reason, go ahead and get your milk out with the hand. Your body is not really going to know if it's the baby or the hand or the pump. But once that milk starts going out, your body's like, oh my gosh, I got to make some more milk. So that really early expression or getting the milk out becomes super important. And in that video, you saw a lot of people like helping out, but many authorities believe that baby can do all of this from the time that they're put on from their mommy's tummy to latching onto the breast, that baby can like do that motion, crying, searching for the breast and latching. And they believe that when baby can do it on his or her own timing, they feel that latching is a little bit better. So if you have a baby who's, gonna know about it, definitely without helping, let them do that. Okay, and then, I'm so sorry. Wait. Okay, so first, I know I'm sharing a lot of information, but if you forget, everything else, this is one thing that I want you to remember. On the first day, baby's stomach is size of a marble, like super tiny, super tiny. And all they need to drink the breast milk is about 2 tablespoons. So 2 of these, really small amount. It's like 1 ounces. And they're gonna take this over the course of 24 hours. So if they have 10 feedings that day, we're looking at like 3 mils, which is like smaller than a teaspoon. So I emphasize this because I come across a lot of moms saying that, oh, I gave up breastfeeding because, gave up breastfeeding because they didn't have enough milk. And this is again where our healthcare system kind of fails moms. We don't inform moms that all they need is like the tiny, tiny drops on day 1. And day 1. Sorry, let me get back to that. And that first milk is called colostrum. And surprisingly, it doesn't have much calories in the colostrum. A lot of what's in the colostrum is made from immune cells. So these cells are being transferred in the form of milk. So it's like a immune system transfer from mom to baby. And this milk ejection is a muscle contraction. So when the milk goes out, it sucks back baby's saliva. And your mom's breast is going to look for any infection in that saliva. And if they detect any infection, then mom will start making antibodies for that specific infection, and that antibodies are ready for that next feeding. So that's why infection is super low for breastfed babies. Also in colostrum, and also the milks, breast milk that is to come, it has human milk oligosaccharides. It's a form of a sugar, and for humans, we have more than 100 types of human milk oligosaccharides. So what they are, they're like little soldiers, and they all have like little different roles. And some will help, make more good bacteria. They work as like prebiotic. Some will line the inside of baby's gut so that the virus won't stick to the wall. Some, when they detect virus, they'll like block the virus. So it's just really amazing. That's why there's so much benefits to gut health when it comes to breastfeeding. And then see what to do the first few days for first few weeks. You're going to be feeding about 8 to 12 times a day. And you probably heard like feed about like every 2 to 3 hours. And that is more to inform moms like how frequently they need to feed, but we always recommend feeding on demand. So feeding when baby becomes hungry. Just like us adults, like if we're sleeping, somebody wakes you up and gives you a huge bowl of spaghetti, how would you feel? So that's same with baby, you know, if they're not hungry, they have a harder time breastfeeding. So feed them when they are hungry. And one thing to know, your baby is going to go through something called cluster feeds for the first 2 weeks or so. What that is that given like a certain time of the day, usually later in the afternoon to evening, so like 5 p.m. to 10 p.m., your baby's going to be like feeding so frequently, like feeding every like 20 minutes, 30 minutes. You're feeling like, what's going on? I just fed her. How come she's not full? Like, I don't have enough milk. Maybe, you know, maybe I need to swaddle her. All of that, like panic comes up, but it's normal. And also it's a perfect recipe to increase milk supply. So what happens is that when you feed, your milk making hormones go up. And because you're feeding so often, your milk tank is low. So then your hormones are like, okay, we need to make more milk. After these cluster feeds, usually baby sleeps for a certain, a good stretch, like maybe 2, 3 hours, 4 hours. And that's when you can, you know, resupply your milk. And that's a perfect recipe for increased milk supply. So I know you're going to be tired, but just believe in your baby and just let baby do this. And this, again, a lot of moms go in without knowing. So that's when we all panic, like, oh, something's wrong with my milk supply. But just know about this. So when to feed baby, watch for hunger cues. When baby starts to wake up, that's a great time to feed baby. When baby's looking for your breast, putting hands to mouth. Crying is the last sign of hunger, so you don't want to wait until baby cries. Try to catch her before she cries. Next. Common questions that moms may have. One, how do I know if baby is getting enough milk? The best indication is baby's growth. So I'm not sure if you can see it well right here. For the first 2 to 3 days, baby is going to lose weight. And then after that, gradually gain back their lost weight. So in about 2 weeks, we want baby to go back to the birth weight. Whatever goes in will come out. So number of wet diapers right here. And also stools. Stools will change in color from dark black to green to yellow. Monitor for those things. Also, how do I boost or keep a good milk supply of milk? So if you're exclusively breastfeeding and if you need to maintain it, just keep on doing what you're doing. If for exclusive breastfeeding moms, baby's milk intake stays the same between 1 month and 6 months. So usually like 4 to 6 weeks, your milk supply goes up. And after that, baby doesn't have to have any more than that, because one, baby slows down in growth. Also, your milk composition changes. Whereas formula, you know, milk composition doesn't change. So you may have to increase the volume, but breast milk amazingly just changes composition to meet baby's goals or needs. There might be some growth spurts here and there. So that's when your baby's intake goes up a little bit, but overall it pretty much stays the same. If you do need to boost your supply, then ask yourself, why do you need to boost your supply? Given that information that you really don't need to increase supply from end of 4 weeks to 6 months, and if your baby is 3 months, what's going on? Is baby going through a growth spurt, or did you introduce bottle recently that you're giving your breast milk through the bottle? When babies drink through bottle, they tend to drink a little bit more than what they need because the flow is a little bit consistent. Also, you know, breastfed babies take breaks when they're feeding. If you notice, like they'll suck, and then, you know, break for a little bit. If you don't give breaks to bottle, like even adults, like when we're hungry, we just eat. And then after you eat a lot, you're like, oh my gosh, like I'm so full. Something similar happens to bottle fed babies. So make sure that you give breaks, pace feed your baby. Also, did your output go down? Did you miss any feedings? Common situation is when you return to work, your routine is disrupted, or maybe you couldn't pump the way that you thought you could. Maybe separation from baby, you went on a one day trip and maybe you couldn't pump. So those things, we want to see what's really going on. And then if you do need to boost your supply, the most effective way is to increase your output, get your milk out. So the best, easiest way is to latch baby on as much as possible. If you're a working mom, on your days off, just latch baby on. If you're a pumping mom, power pumping. So that cluster feeding that we talked about, that's actually what it is. Feed, 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 pump, 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 get your milk making hormones up. If you still need to do something, renting a hospital grade pump might be an idea. Hospital grade pumps are made to increase supply, and our home personal pumps are to maintain milk supply. So if you want to just kind of increase a little bit, some working moms will rent a hospital grade pump for the first 2 weeks when they return to work. And use that. Also see a lactation consultant. She knows a lot of tricks and also really can see what's really going on with your life. So I get a lot of questions about lactation cookies. I really don't go there because one, they're not proven, it's not really regulated. So whatever is claimed to be in there, it may not be, or really small amount might be in there. And my number one pet peeve is like, it's overpriced. You're paying like $25 for like 10 cookies. If you're going to pay that price, you can rent a hospital grade pump for like 1 week, So also what's in the cookies, like the common ingredient is brewer's yeast. It's really bitter. So to mask that, you have to put in a lot of sugar and a lot of fat. And moms are trying their hard to replenish their body, eat well, also lose weight. So it just doesn't make sense. So that's where my dietitian part comes out. I get like really heartbroken because like moms are trying their best, and I think it's just overpriced. And yeah, but anyways, I'm going to the next slide. Okay, when to seek professional help. So when you suspect your baby having a tongue tie, lip tie, or even a buccal tie, this is a whole separate talk on its own. I'm very passionate because both of my daughters had tongue tie, lip ties. It's really not about how it looks. It's about how the tongue works, how baby is doing. So to do a full assessment, you really have to put your finger in baby's mouth, feel the restriction. And then see how baby is feeding, see how mom is doing. And I don't know any pediatrician in town who does that kind of assessment. If you do know, please let me know. So it's not, if your pediatrician tells you, oh, it doesn't look like baby has any restriction, like that's not it, there's more to it. So please seek help. And if baby is not gaining weight, definitely reflux, gaseousness, milk protein allergy. There was a research out recently saying that milk protein allergy is definitely overdiagnosed. Also, if baby is diagnosed with reflux, most likely getting prescribed with medication, but a lot of times it's not really reflux. It could be like tongue tie where baby's swallowing a lot of air causing, the reflux symptoms. So seek help. Also, if mom is having consistent nipple pain, I work with amazing moms. They're like latching baby on, pumping, and baby grows well. So from a pediatrician's perspective, things are going well. But mom is just, exhausted, pumping, latching, having all that pain. So yeah, reach out for help if you're in that situation. Also, recurring engorgement, clogged ducts, mastitis. If you're going back to work, you often hear like pump every 3 to 4 hours, but what if you're in a profession that you cannot pump every 3 to 4 hours, then what to do? Also, we work with bottle-fed babies. So there's so many bottles. They all say that they're the best ones. It resolves colics. We can work with your baby to find that bottle for you. Also, last but not least, mommy's instinct. You're the expert of your body. You're the expert of your baby. If you feel like something is not right, reach out because you're probably right. And then if you do seek help, I just wanted to share with you what happens in a typical home visit. We spend usually about like 90 minutes. This was my pet peeve working in a clinical situation because we were only given like 45 minutes, and that's really not enough to really assess what's going on. We talk to you about your medical history, baby's medical history, your goals, what kind of challenges you're facing, family dynamics. We look into baby's mouth for oral examination. We observe a feeding session, and we take measurements before and after feeding so that we know how much baby is drinking. I do therapeutic breast massage. I'm Japanese. I go to Japan every summer, and I learn from midwives how they do their massages. It's pretty interesting and pretty cool. But it's not for all the moms because there's some situations where you don't want to overstimulate your breast. So it really depends on what situation you're in. Being a dietitian, I love to talk about nutrition. And then after all that, we discuss what we can do to better the situation. And if needed, I make referrals, and all the referrals that I make, I have met with that professional or visited their office. So I try to do all the legwork for moms because I want to make sure that my moms and babies are in good hands. And then you have 2 weeks unlimited access to me, a dietitian and lactation consultant, so you can ask any questions. But I think that's pretty typical for all the consultants. They really spend time with you. So seek for help if you do need to. And that's pretty much it. I go a little bit more deeper in the course that Thrive Postpartum offers. Yeah, so if there's any questions, I'm happy to answer any of them.
Mihoko, there's a couple questions that were put in the chat.
Okay.
The first one says that I've heard breastfeeding can be painful in the beginning. Is that normal or avoidable?
Yeah, definitely avoidable. With a good latch, it's pretty much about the latch, how you saw in the video. So we want to get that good deep latch from the beginning. So it's really good to meet with a consultant or have that education ahead of time to know what is a good latch, what is not a good latch. So definitely avoidable. And I strongly recommend this because once you get like cracked, bleeding nipples, it's so hard to deal with pain. So yeah, definitely. And if you do start to get a little bit of abrasion, like reach out for help right away. There's different ways to prevent it even from that point. So yeah, great question.
Awesome. And then there is, can what you eat affect breast milk? Gassy baby, broccoli, or garlic? And then they also asked about alcohol and breastfeeding.
Yes. So the first question, wait, I'm trying to get out of my screen. So the first question was if what you eat can affect breast milk. The gassiness. So recent research shows that what you eat doesn't really affect too much. So we used to think like, the cruciferous vegetables, the broccoli, the cabbage, all of that, when we eat, baby will get gassy. So when you look at how breast milk is made, it goes into your stomach and then it's converted to your blood and then to breast milk. So what's in your stomach doesn't really directly go into breast milk. So now we're thinking that it's more of like the positioning, baby's getting more air, could be like, the thighs. So for that question, not really. So you can pretty much eat whatever. Yes, some babies can be super sensitive. So if you notice that certain foods, like, there's always that dairy thing. And like I mentioned, milk protein allergies are overdiagnosed. But if you do suspect, it's good to kind of like stay away for like 2 to 3 weeks and see how it goes, and then slowly reintroduce. And the next question was, I'm sorry, what was the next question?
The other one was alcohol and breastfeeding.
alcohol and breastfeeding. Yeah, so this is really interesting. In Europe, people do drink, and still breastfeed. So the benefits of breastfeeding outweighs the risk of having alcohol in your breast milk. And we're also talking about volume here too. Like if you're like a heavy drinker and breastfeeding, that's a different story. But if you're doing like, a glass a day or whatnot, you can still breastfeed. And also if you want to make sure that you're not affecting baby, we used to say pump and dump. So you pump your milk, breast milk, and then dump it. Or now they're more saying that with research, you can wait a few hours and then, or you can drink, you can breastfeed and then drink and wait out a few hours. But I guess the message here is that the benefit of breastfeeding outweighs the benefit of the risk of not breastfeeding. I'm sorry. So yeah, if you want to drink, definitely consult with a consultant, because it really depends on what type of alcohol, what you're drinking, how much, and all of that. But bottom line, don't stop breastfeeding just because you want to have a glass of wine here and there. And it's the same for tobacco as well.
Awesome. And then the last two. One is asking about how to avoid the nipple blebs, the milk blebs.
Okay, so milk bleb is clogged duct that surfaces on the tip of your nipple. So you might have like little whiteness on the tip. Again, this goes back to having a good latch and then having a good position. So it goes back to that. But if it recurs, there's other things that you can do with diet as well, and possibly some supplements like lecithin and stuff.
Awesome. And then the last question is a good resource for finding donor milk if they do have issues where they cannot breastfeed.
Yeah. So unfortunately, Hawaii doesn't have locally, but there's one that I usually recommend, but I kind of have a brain fart right now. But you can definitely search donor breast milk, and then if it's from a legitimate source, they are going through screening of the donor, pasteurization, and all of that. So you can probably find it fairly easily. I think it was the North America. I'm so sorry, I just kind of don't have it in my mind right now. But yeah, if it's a legitimate source, they go through all of that. So you can definitely contact them.
Awesome. Thank you so much, Mihoko. I think that's
okay. All right.
Yeah, so Mihoko is also in our main How to Thrive Postpartum course. So our breastfeeding section is thick with all of her awesome information. He's over everything right now. So if you want to learn more from her, I'll send out an email here in a little while that has information that'll take you right to her website if you want questions. But if you want the deep dive of what she's just gone over, it's in our How to Thrive Postpartum course. And then we're still doing our giveaway. Like I mentioned, we're giving away one free course to a lucky mama. So if you are here, make sure you're putting here, so that way we know how to take tabs and who will be our winner. But that is all for today. Today was amazing. And thank you to our speakers and everybody who's attended. And we hope that we see you tomorrow. Tomorrow's exciting. It's going to be Jessie again with the functional fitness. And then we're going to be having chiropractors on to chat a little bit about how chiropractic help can help mom and baby. So another great day tomorrow. And we'll see everyone tomorrow. Bye.